I like the triple bend in the tip because it allowed me to have better access to the mesial and the distal surfaces without having to move a lot. And I think that the slimline is always the best because if I have a deeper pocket, a thicker tip won't allow me to have good access underneath it. So you had the combination of all the things that I think as a hygienist I would want. It's slim, it's easy to get into, I can get deeper into the pocket or the furcation, and if it's a tight space, if there's rotation in between the teeth and I can't put a bigger tip into there, because it's thinner, I have better access.
The slimline 1000 I was able to use on younger patients as well as older patients. It was very versatile. Those with heavy debris, those with strictly gingivitis with plaque and material alba, it worked well on everyone.
My first impression after using the insert was one of comfort, good tactile sense, and easy orientation to anywhere in the arch.
My immediate first impression, just looking at the tip, was I wasn't sure about the not having the curve and having the bend, but I really liked the bend. I thought that was an option that gave me really good access to the areas I used it most in.
When I used it the other day on a patient with a permanent lingual bar, and all I had to do was just turn it just a little bit and it just went up underneath that bar and cleaned it all off, I was like, oh, this is nice. I mean, I love my slim lines because you can get into the pockets. I don't like the thicker, the tipped ones. And then when I used that, I was like, oh, wow, who thought of that? And I'm like, this is nice.
I'd say my one key factor as far as what really stood out about the new insert was its adaptability.
Accessibility on the lower anterior linguals would be my favorite. It seemed to, I try to eyeball it and then go back and recheck with my mirror and such, and I didn't have to touch up a lot after I used the slimline 1000.
Using it at line angles and taking it comfortably around the tooth surface, it's very easy to feel where you are.
The biggest benefit for the slimline 1000 for me again was my accessibility in all areas of the mouth. I truly enjoyed using this tip.
I just prefer the slimline. Isn't thin in? Doesn't everybody want to be thin?